Hey guys, Dr. Ray Marque here, your local chiropractor at Back Pain Relief Center. This is our Monday edition of Dr. Ray TV, and it is live. So if I stumble or mess up, that's just because we're doing this thing live. I'm coming to you from our South Carolina office down in Murrells Inlet. We're at Back Pain Relief Center again. I'm sorry, and we're two locations. So I got my South Carolina office in Murrells Inlet, and I have my New Jersey office in Vineland. So I know that gets a little confusing for some people, but I'm up in New Jersey on Wednesdays and Thursdays. I'm down here in South Carolina on the other days. If that gets confusing, for Back Pain Relief Center Murrells Inlet, just go to murrellsinletchiropractic.com. Again, that's murrellsinletchiropractic.com. If you're up in New Jersey, it's backpainrc.com. Again, backpainrc.com. All right, today we're going to talk about chronic neck pain relief when others couldn't get any relief, okay? And we're going to talk about why I was able to get some relief for this patient when some of the other doctors may not have been able to. So a little story, we had a patient last week that came in on Friday, very, very pleasant young man who had a pretty bad neck problem. And his neck was causing him so much pain that it was shooting pain down his arm, and he was getting some tingling in his fingers, and he actually lost size of his muscles, so his muscles were atrophying, and which was really bad for him because this guy was a bodybuilder and a powerlifter, and it was really affecting his lifestyle. So he wanted to continue to go to the gym and lift weights, and he wanted to continue doing the things he likes to do, and he was unable to because he wasn't getting the right signals down his arm. So he was having so much pain that it was affecting that his brain couldn't feel where his arm was, and he was losing some muscle size on there. And that just tells us that we have a degenerative process that's probably been there for a little bit, and something really needed to be done. So let's talk about what he had done. So number one, about a year ago, and it put a lot of pressure on that joint, and it herniated or bulged the disc, and it pushed out and pushed on the nerves, and he felt that pain down the arm. So he went to the doctor that he should have went to. He went to an orthopedic surgeon, and they looked at him, they evaluated him, they took some x-rays and also did an MRI, and they saw exactly where the problem was, and they began a series of injections, and they tried some physical therapy. But kind of none of that to any avail. It really didn't relieve the problem. So their next course of care was to recommend surgery. So this young man actually even went as far as to talking to some other neurosurgeons who recommended surgery. He actually went and talked about the prolotherapy, which is where they do the injections of the stem cells in your neck, and they gave him some hope there too. And he tried all different kind of therapy. So he tried some previous chiropractic. He tried, which was just manipulations. He also tried some dry needling, which gave him some relief. And he tried some massage therapy along with the injections, along with the medication, and nothing seemed to be working. So what did I get out of all of it? So first thing I did was, I got a full history. So we got a good grasp of what he's been doing in the past that could possibly be affecting his neck. Then we also went over all of his doctor's reports, so see what they're actually doing to him. We went over his MRI, figured out exactly what the problem was. And what we came up with was a predominant C6, C7 disc herniation in his neck. So that's right at the base of his neck, which was pinching the nerve on both sides. And he was feeling pain on both sides and tingling in the fingers and some weakness. Okay, so we know what's going on. We know we got a bad neck. We know we have some pinched nerve. We know we have some bad discs. Furthermore, we did some more evaluation, and he just had a ton of tone and tautness to all of his muscles. And what's that mean? Well, his trapezius muscles, his upper back muscles, his chest, his shoulders, all of it was very, very tight. A lot of trigger points in some key spots, meaning the muscles have spasmed and knotted up, and all this tightness and tones and muscle knots were further inhibiting range of motion in his neck. So it was getting so tight that there was a lot of added pressure to the neck. And which is all normal. People get these conditions, and they get like that when your body's defending itself. When your body doesn't want you to move that neck anymore. Hold on one second. When your body doesn't want you to move that neck anymore, it will tighten up, okay? In addition to all that, we figured out that he has, he brought on a repetitive stress type injury with all the training he's been doing. He's been lifting weights 6-7 days a week, And I think it was just all further adding on to this. So what do we decide to do? This is what I decided to do. And when I talk to everyone, it's really the same thing when we're looking at neck and back problems. We need to do certain things. Number one, we need to decompress that joint. We need to get the pressure off the joint. And that, whether it's in your neck or your low back, we need to get pressure off those joints and off that disc so hopefully they can subside a little bit. That's first and foremost. We need to increase range of motion of that joint. We got to try to get that joint to work better, because if we decompress it and increase range of motion, the inflammation will begin to go down. And that's the next thing. We need to get the inflammation down. Okay? So we need to decompress it, realign it so it works correctly, get the inflammation down, increase range of motion, and we need to loosen up all the muscles. So how do we do all that? So this is what we did. We first went in there and we did some active release and some myofascial work on all of his muscles, meaning that we did some trigger point therapy, we did some stretches, we did some exercises, all to loosen his upper back muscles up, his lower cervical neck muscles, his chest, his shoulders, everything in this entire area to take that pressure off of the low neck, or the lower neck. That was the first thing. The next thing that we did is we used a cold laser, and we cold lasered all the key areas that we identified in our history and our exam and in our MRI, to try to attack the inflammation where the nerves are, to try to attack the inflammation where the disc is, and to get all that stuff to loosen up and to decrease inflammation and to feel better. So we did muscle work first. The next thing we did was some cold laser to help with the pain and inflammation. After the muscle work, after the cold laser, then we moved on to the spinal manipulation. Now with this particular gentleman, we used a spinal manipulation in his neck. I felt it was warranted to help decompress the neck. Is it appropriate for everyone? Absolutely not. For this particular gentleman, a spinal manipulation to his lower cervical spine was highly appropriate. We got a good cavitation, meaning that it cracked pretty easily, and he felt immediate release of pressure. Okay, so we did some muscle work. We did some cold laser. We did a spinal manipulation. Okay, the next thing that we needed to do is give him some stuff to do at home. Okay, so what do I want him to do at home with this? We wanted him to do some home exercises, which included some chin glides, very specific for taking pressure off the low neck, and some home traction, whether we did it seated in a chair or we use an actual pump on his neck to stretch out the ligaments and the muscles to help decompress it. So exercises, traction, cryotherapy, ice in his neck. For this guy, 3 or 4 times a night if we can. Absolutely no heat, okay? And why no heat? Because we have a neurological symptom. We have a nerve problem there. Pain's moving from one area to the other. Heat will make it worse. Definitely ice for this time. We're gonna have him use a TENS unit, okay? A TENS unit on the base of his neck, and that'll help block some of the pain. And we're gonna do that daily, okay? So, what else will we need with him? We may need some injections, and we will refer him back out to his medical doctor to get a series of more injections, because the injections will help decrease inflammation. It'll help get the pain down. It'll help increase our range of motion, which in turn will help decompress it. I told him to try everything possible. So go back to the massage therapist, go back to the acupuncturist or whoever's doing the dry needling. Go to your neurosurgeon, suggest some more injections. I think when we have problems like this, we need to get every single profession involved, work as a team to get the patient better. So back to the heading of our talk here is chronic neck pain relief. So why do I believe that I could get some relief when some of these and high educated neurosurgeons and orthopedics couldn't? I think that they absolutely can get things done, but when it comes to some of these disorders, and this isn't everyone, but with many of these disorders, especially your neck and your back, we need to look at it as a team approach. So say he just came to me and me alone. I don't think my services or chiropractic manipulations or treatment alone is enough for this guy. I think we need to bring more things on. On the same token, just going to get injections or just starting to take some medicine or physical therapy by itself isn't enough to get someone better. I think you have to find out what works well for you and grab a little bit from each profession to try to get you better. This is a management issue. Once we get to the point where we have herniated disc or bulging disc, each and every individual has to find out what works well for them. So some it's chiropractic, some it's stretching, some it's orthopedics, some it's physical therapy. Some it's just sitting down every night and praying about it, okay? Whatever it takes, or a combination of whatever it takes, will help you feel better. So I was able to start getting some relief because I looked at it globally. I looked at his muscles, I looked at the joint, I looked at what he's doing at home. We worked on everything to begin to get him better. And at this point, he is still an ongoing patient. And he may be for a while at some point, because it is a management issue. Now, I'm not saying that he needs to come 3 times a week for the next 6 months. I think we're going to see him 3 times a week for a couple weeks here, and then we're going to back him right off to once every few weeks, and then maybe even once a month, just to help him manage this issue, because I feel he will respond well. If we didn't go to where we wanted to be, I have absolutely no problem getting him to the right professionals, and even if that means a surgical consultation in order to get him better, because this young man, like all my patients, I don't want them to stop doing things in life because they have an injury. I think we can keep you in the game, we can keep you in your sport, we can keep you on the mat, we can keep you doing all the things that I believe you should be doing if it brings you pleasure and you're happy with it. We may have to alter how you do it, but I think keeping you doing what you love doing is more important than anything. All right, so chronic neck pain relief, if you'd like to hear more about it, you can go to MurrellsInletChiropractic.com, your local chiropractor in Murrells Inlet. Again, that's MurrellsInletChiropractic.com, your local chiropractor in Murrells Inlet. If you're in New Jersey, it's VinelandBackPainRC.com, and that's a Vineland chiropractor at Back Pain Relief Center. I hope all is well. Thanks for everyone out there watching and listening. If you have anything you'd like me to talk about, make sure that you message me, and I'll be sure to talk about it. All right, guys, I'll see all my Vineland people here in 2 days, and I look forward to seeing you. Bye-bye.